Welcome back to part 3 on our
Breast cancer treatments.
new stuff
Yes, this is new stuff.
on Senior Boat with Nurse Linda, and there's Nurse Linda, and I am anonymous. My throat's going. But anyway, the first 2 parts are very interesting.
Mhm.
Surgery and the alternatives. Now I want to hear what's new.
Okay, these are some therapies that are in clinical trials, but they're moving along very quickly with what the benefits are. And again, we're talking risk versus benefit, and your doctor is the person who will help you make that decision. But one of the things that is very commonly used now is what they call targeted therapy. And we're getting into Star Trek kind of stuff here, which is the
Ooh,
fun
Star
part.
Trek. I like
Yes,
Star Trek.
yes. What targeted therapy does is it uses drugs or other substances to identify and attack only the cancer cells. And what you're doing is you're sparing the healthy cells and a lot of the side effects that go along with treatment. One of the things they're using, which is most common, is monoclonal antibodies. And what that does, and forgive me for referring to notes, I want to make sure I get this right. It uses antibodies made in the lab from your immune system. And these antibodies identify substances that help the cancer to grow. Then they can target these substances to keep the cancer from growing. Cancer cell, like any other cell in your body, only has a specific lifespan. So most therapies are targeted at just taking care of the newer cells. Let the older cells die off and let them go away.
I didn't know cancer cells died.
Yes, absolutely. And you just want to take care of just the newer ones and let the older ones do their own thing.
Those are like a starfish. They lose a leg, they grow another one.
It's not quite that way with cancer. If you kill a piece of it off, it doesn't regrow in the same spot, no. But it will grow elsewhere. So you want to take care of the new stuff. These substances will either kill or stop the new growth. They're given intravenously, and they may carry drugs, they may carry toxic substances, they may carry radioactive substances. All to be, the purpose of is attacking those cancer cells. The positive part is they don't just go to the tumor, then if there's other cells in the body somewhere, they attach to and attack those as well. So many times this is used in conjunction with regular standard chemotherapy. They do this as an adjunct, is what they call it. Some of the things you'll hear words like trastuzumab,
What?
pertuzumab. These are all drug names.
Ah.
Almost anything with an umab or imimab name at the end is usually some sort of monoclonal drug.
Okay, what's a monoclonal drug?
Monoclonal antibodies are these specific antibodies in your body that are created, they're grown, and are used to identify these other substances. So that's the name of the therapy. One of the other therapies that they have, which was at one point a little more accepted, they've kind of gotten away from it a little bit, is high-dose chemotherapy in addition to a stem cell transplant. Now, everyone's been familiar with stem cell transplants, with Robin, the newscaster on TV, had just gone through that. So everybody's been watching her foray through that. This is high-dose chemotherapy to kill the cancer cells and a lot of the other normal cells in your body and then replace them. So what the process is, they go through, they remove blood, spin out stem cells from your own system. They clean them up and store them, they freeze them, put them aside. Then they put you through this high-dose chemotherapy that pretty much kills everything. It puts you at high risk for infection. You have to be put in isolation and things of that nature. Makes you very, very ill. You lose all the hair you have. And then they start replacing it. Then they give you back your own stem cells. And then they give you medications to help those stem cells grow and reestablish your normal blood cell line. The idea is to prevent further cancer from growing. This is usually used once they determine or feel that you don't have any other cancer cells in your body, but many times cancer cells are microscopic, they can't be found, so this is to take care of anything that might be lagging behind.
Sounds radical.
It's very radical. It's used a lot in leukemias, and they were using it more often in breast cancer therapies, but they have since found out that it really doesn't seem to work any better than standard treatments, chemotherapy, radiation, surgical treatments. So right now it's only being used in clinical trials to better determine what is the best method of approach for this and what have you. Clinical trials themselves are very interesting. You have an opportunity to get a drug or a combination of drugs that may give you an added benefit to your treatment that you would not have if you choose standard therapy. You do have to agree to be tracked, you have to fulfill certain obligations. It's usually nothing terrible. The other advantage is when on clinical trials, your insurance company, you're not charged anymore. And sometimes it's a benefit to your insurance company because the drugs are provided free of charge.
Uh-huh.
Okay, you might have to pay for the routine blood tests, but if there's extra blood tests involved, then that's taken care of by the study. So you do have a benefit there. National Cancer Institute, National Institutes of Health, the American Cancer Society, and your local oncologist can all help you to determine if a clinical trial might best fit your
This
need.
information is available by Googling.
You can Google those things up, the National Cancer Institute, the National Institute of Health. You can go to cancer.gov and you get information there on clinical trials in your area. You can also call 1-800, the number 4 and the word cancer. 1-800, the number 4 and the word cancer. People can also call us and we'd be happy to answer any questions they have or hook them up with this information.
That number is 803-941-7231. That number again, 803-941-7231. It doesn't matter where you are.
No.
You'll be glad to talk to them.
Absolutely.
And you can watch these on www.brookhc.com. That's BROOKHC.com. What else you got?
And that's it. Next week, we're going to talk about maybe some complementary therapy, some other things people may be doing, what's good for you, what's not, how to figure out what you might want to try, and see if we can come up with any questions. If anybody has any questions, we'd be happy to answer them and sort of clear things up a little bit.
Yeah, drop us an email at brookhc@sc.rr.com. That's brookhc@sc.rr.com. It's on the sign back there, so look at it, do something
Yes.
about it. And thank you for watching. I hope you got something out of this because it could mean your life.
Absolutely.
And we'll see you next week.